What does the informed consent process for modafinil look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. Now, modafinil is not a commonly prescribed psychiatric medication, but it is one that I've gotten questions about multiple times, so I'm going to do it. So modafinil is kind of an atypical stimulant, and it works by blocking the dopamine transporter DAT and thereby increasing the available dopamine. But it also has a lot of effects on other neurotransmitters, including orexin, which activates other wake-promoting pathways and can lead to increased alertness and vigilance. It additionally has effects on histamine, norepinephrine, and GABA systems. So modafinil was originally FDA approved in 1998 for the treatment of narcolepsy, but it has since gained a couple of other FDA indications, including obstructive sleep apnea and shift work disorder. It is not FDA approved for any psychiatric indication. However, because of its boost in alertness and focus, it is sometimes used off-label for psychiatric reasons. These might include targeting the cognitive deficits in schizophrenia, residual fatigue, or cognitive issues in major depressive disorder, as well as ADHD. But because of the way that it acts on dopamine and norepinephrine, it does carry unique risks, including risk of triggering mania, as well as worsening psychotic symptoms, potential of worsening anxiety, and causing SI. And although it's not as reinforcing as a stimulant or other recreational stimulant drugs, there is still a potential reinforcing effect. Some can experience euphoria. And so for this reason, among those other reasons, it is used with extreme caution in patients with psychiatric conditions. It's not endorsed for use in children due to safety concerns. There's actually a REMS program for this medication. The name brand is called Provigil. REMS stands for Risk Evaluation and Mitigation Strategy. So we also have one for clozapine, although this was recently done away with. But because of all the potential adverse effects and something called hypersensitivity syndrome, it is prescribed with a lot of caution. What this REMS program means is that basically there's additional paperwork and monitoring that's required by the prescriber in order to be able to prescribe that medication. Common side effects include like headache, nausea, diarrhea, upset stomach, anxiety or insomnia, nervousness, dizziness. Sometimes you can get a runny nose, and sometimes back pain. More serious adverse effects can include things like Stevens-Johnson syndrome, which is a potentially very dangerous rash that involves lesions in your inner skin. So things like your eyes, your nose, your ears, your mouth, your vagina, and your anus. This is a medical emergency if this occurs. And as a stimulant, it's also going to have the risk of increasing heart rate and blood pressure. And so it's important that someone is cleared by their primary care doctor or cardiologist if they have a significant cardiac history. It can also interact with birth control pills, so it's important that if you're taking this medication and an oral contraceptive, that you may want to consider doubling up with some other form of contraception if you don't want to get pregnant. And along with the abuse potential, there is also the risk of dependence. And when I say dependence, what I mean is that your body gets used to having the medication, and so if you try to take it away, then your body is going to go into withdrawal. And usually withdrawal is going to look like the opposite of the effect of the medication or substance, so it might look like drowsiness, brain fog, fatigue. And so the modafinil hypersensitivity reaction is going to involve the Stevens-Johnson syndrome, as well as something called DRESS syndrome, DRESS. This stands for drug rash with eosinophilia and systemic symptoms, as well as toxic epidermal necrolysis, which is another really dangerous skin condition. And angioedema, which is swelling of the face, nose, and throat, as well as allergic reaction, are also potential adverse effects. So symptoms to watch out for would be any rash, any blistering, any swelling, or trouble breathing. These would all be reasons to stop the medication and seek medical attention. So now you may be able to see why, if you've asked your psychiatrist about modafinil, they may not have wanted to prescribe it, because when something carries along with it all of these risks, as well as the added administrative burden of going through the REMS process, then you really want to make sure that the potential benefits of a medication outweigh the risks. And of course, that is more challenging to do when you're using something off-label that has not been FDA approved. Now, I personally have not prescribed this. I have had some patients who've been on it, but it's usually prescribed by neurology. If you have any questions about this, or there's another psychotropic medication that you want to hear me go through the informed consent process for, then put it in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future courses or resources or offerings, and I want to be able to communicate directly with you all. So if that's you, send me a DM with your email, and I'll see you in the next one.